Dr. Nigel Murray, President and CEO of Fraser Health Authority, Chief Executive of 23,000 employees, which is an exciting team to lead, hugely professional, great commitment and passion. I've been across our organization from one end to the other, met thousands of staff, and one thing that I've been totally impressed with in the 2 years that I've been here is just the complete commitment to professionalism that we have. So with all that energy and focus, there's so much that we can do, and it's exciting to be here as the leader of such a health authority here in British Columbia and Canada. So there's a big black cloud on the horizon of healthcare planning and thinking at the moment. It's around the world. Every government faces it, every health authority faces it, every community group faces it. Is how do we afford to do the things that we want to do, let alone need to do? And how are we going to marshal enough resources to make sure that we sustain the health of the populations we serve? Let's face it, we're aging, we're living longer, and the costs of that kind of delivery grow every year. In fact, our costs generally grow between 6 and 8% every year, just about to do the same thing with no new growth. That's population growth, that's the inflationary pressures, that's making sure people are fairly compensated for the work that they do and meeting our collective contracts with employee groups such as the unions. All of those things make the cost structure grow and not necessarily delivering new or better services. And with a recession around us, that makes it extra difficult. And presently, most government revenues would be well down, probably below 1%, yet our cost structure is growing at 6 to 8%. Now, we just know that's not sustainable. If you just extrapolate that on a graph, it will just keep going and going and going, and the cost structure will grow and the revenues will stabilize, if not decline. And therefore, there is a problem. And we can't just deal with that on a day-to-day or month-to-month or year-to-year basis. We have to look forward 2 to 3 years and say, how is this going to be sustainable? And it may be, and I think it's becoming to the realization of many, many people in this industry, that, and in the public domain, that all the things that we want to provide as part of our public health service may not be affordable. And what we ideally want to hold on to is providing things that we need to provide. So hard decisions are being made. They will continue to be made, and quite frankly, those decisions will get harder as time goes on. So we need mechanisms to help us with that decision making. They need to be ethical decisions. They need to be common sense decisions. They need to be decisions that are commensurate and consistent with our values as a society and as an organization. So how do we do all that? Well, that's the type of thinking that's happening in Fraser Health as we speak. Our executive team, our board that we report to, think about these sort of things regularly, and they've helped us, these approaches, to make sure that we cut our costs, we reduce our administration and support costs, but at the same time, where we have to make cuts into clinical services, that they're done in a way that is prioritized against an evidence-based framework.